Which layer of the skin contains blood vessels, nerves, and sweat glands? A. Epidermis. B. Dermis. C. Subcutaneous tissue. D. Hypodermis. Answer B. The dermis is the middle layer of the skin, providing support and nourishment to the epidermis while housing blood vessels, nerves, and sweat glands. The humerus articulates with which bone at the shoulder joint? A. Scapula. B. Clavicle. C. Radius. D. Ulna. Answer A. The humerus forms the ball of the ball and socket shoulder joint by articulating with the glenoid cavity of the scapula. Which part of the brain regulates balance and coordination? A. Cerebrum. B. Cerebellum. C. Medulla oblongata. D. Thalamus. Answer B. The cerebellum coordinates voluntary movements, maintains posture, and ensures smooth motor activity. The heart's left ventricle pumps blood into which artery? A. Pulmonary artery. B. Coronary artery. C. Superior vena cava. D. Aorta. Answer D. The left ventricle pumps oxygenated blood into the aorta, which distributes it throughout the body. Which organ is primarily responsible for filtering waste from the blood? A. Liver. B. Kidney. C. Spleen. D. Pancreas. Answer B. The kidneys filter blood to remove waste products, regulate electrolyte balance, and maintain fluid homeostasis. The functional unit of the kidney responsible for filtration is called A. Nephron. B. Glomerulus. C. Bowman's capsule. D. Renal pelvis. Answer A. The nephron filters blood and forms urine, with the glomerulus and Bowman's capsule being components of this unit. Which type of joint allows the greatest range of motion? A. Hinge. B. Ball and socket. C. Pivot. D. Saddle. Answer B. Ball and socket joints, like the shoulder and hip, allow movement in multiple planes including rotation. The smallest bone in the human body is located in which part? A. Ear. B. Hand. C. Foot. D. Spine. Answer A. The stapes bone in the middle ear is the smallest human bone and is involved in hearing. Which muscle is primarily responsible for flexing the forearm at the elbow? A. Triceps brachii. B. Biceps brachii. C. Deltoid. D. Brachialis. Answer B. The biceps brachii contracts to flex the elbow, while the triceps extends it. Which blood vessels carry blood away from the heart? A. Veins. B. Venules. C. Capillaries. D. Arteries. Answer D. Arteries transport oxygenated blood away from the heart, except pulmonary arteries, which carry deoxygenated blood to the lungs. The structure connecting muscles to bones is called A. Ligament. B. Tendon. C. Cartilage. D. Fascia. Answer B. Tendons attach muscles to bones, transmitting the force required for movement. Which organ produces insulin? A. Liver. B. Pancreas. C. Gallbladder. D. Thyroid. Answer B. The pancreas contains islets of Langerhans, which produce insulin to regulate blood sugar levels. The right atrium of the heart receives blood from which vessel? A. Pulmonary vein. B. Pulmonary artery. C. aorta. D. Superior and inferior vena cava. Answer, D. Deoxygenated blood from the body enters the right atrium via the superior and inferior vena cava. Which part of the nervous system controls involuntary functions like heart rate and digestion? A. Somatic nervous system. B. Autonomic nervous system. C. Central nervous system. D. Peripheral nervous system. Answer, B. The autonomic nervous system regulates involuntary processes, divided into sympathetic and parasympathetic divisions. The primary bone forming the forehead is called A. Temporal. B. Parietal. C. Frontal. D. Occipital. Answer, C. The frontal bone forms the forehead and the upper orbit of the eyes. Which organ stores bile produced by the liver? A. Stomach. B. Gallbladder. C. Pancreas. D. Small intestine. Answer, B. The gallbladder concentrates and stores bile, releasing it into the small intestine to aid digestion. The axial skeleton includes A. Arms and legs. B. Pelvic bones. C. Hands and feet. D. Skull, spine, and rib cage. Answer, D. The axial skeleton provides central support and protection for the brain, spinal cord, and vital organs. Which type of blood cells defend the body against infection? A. Red blood cells. B. White blood cells. C. Platelets. D. Plasma cells. Answer, B. White blood cells are key components of the immune system, fighting pathogens and foreign substances. The trachea branches into which structures? A. Esophagus. B. Pharynx. C. Alveoli. D. Bronchi. Answer, D. The trachea splits into the left and right bronchi, directing air into the lungs. Which part of the eye controls the amount of light entering? A. Lens. B. Iris. C. Retina. D. Cornea. Answer, B. The iris adjusts the pupil size to regulate light entry, protecting the retina and aiding vision. The scapula articulates with which bones? A. Humerus and clavicle. B. Humerus and radius. C. Clavicle and sternum. D. Radius and ulna. Answer, A. The scapula forms the shoulder joint with the humerus and connects to the clavicle for shoulder stability. Which organ is responsible for producing bile, detoxifying chemicals, and metabolizing drugs? A. Kidney. B. Liver. C. Pancreas. D. Gallbladder. Answer, B. The liver is multifunctional, including detoxification, metabolism, and bile production for digestion. Which type of joint is found in the fingers? A. Ball and socket. B. Gliding. C. Pivot. D. Hinge. Answer, D. Finger joints are hinge joints, allowing flexion and extension movements. The spinal cord extends from which part of the brain? A. Cerebellum. B. Medulla oblongata. C. Thalamus. D. Hypothalamus. Answer, B. The medulla oblongata continues into the spinal cord, controlling vital reflexes and transmitting signals. Which bones form the lower jaw? A. Maxilla. B. Temporal. C. Zygomatic. D. Mandible. Answer, D. The mandible is the largest and strongest facial bone, forming the lower jaw and supporting teeth. Which part of the small intestine absorbs the majority of nutrients? A. Duodenum. B. Jejunum. C. Ileum. D. Cecum. Answer B. The jejunum is specialized for absorption of carbohydrates, proteins, and fats. The main function of platelets is to A. Carry oxygen. B. Fight infection. C. Aid in blood clotting. D. Transport nutrients. Answer C. Platelets initiate clot formation to prevent excessive bleeding after injury. Which nerve controls muscles for facial expression? A. Trigeminal nerve. B. Facial nerve. C. Vagus nerve. D. Optic nerve. Answer B. The facial nerve, cranial nerve 7, innervates muscles for expressions and some taste sensation. Which bones protect the brain? A. Cranium. B. Vertebrae. C. Sternum. D. Ribs. Answer A. The cranium consists of cranial bones forming a protective case around the brain. The alveoli in the lungs are primarily responsible for A. Moistening air. B. Gas exchange. C. Filtering dust. D. Producing mucus. Answer B. Alveoli provide a large surface area for oxygen and carbon dioxide exchange with the blood.